what kind of prevention can we have in place for hepatitis?
Very good question. This is very good, and that's why I think you're here. That's number one. You are already doing well with respect to preventing this. One is awareness. And we thank channels, television, because you people are always there in the forefront, championing a lot of disease situation and trying to make the public get aware of that. So the first thing is awareness. And when people are aware of something, the battle is, more than won. The next thing is for the people, because they're aware, to go for screening. Go to for screening test, simple test, they take little sample from the body and they check whether the germ is in the person. Because the germ might have been living in some people for 20 years, 30 years without their knowledge. And later there could be problem. And the thing is to prevent that problem. So when people know that they have the problem, then of course they will now need the experts or people who are knowledgeable about hepatitis to try and work along with them in mitigating any bad effect. Having said that, hepatitis B also is one of the few viruses or few whatever that can be prevented by immunization. In fact, immunization is one of the safest vaccines that can be given. It can even be given to pregnant women. The vaccination, children, even newborn babies just born can be given hepatitis B vaccine, and it's safe. And that is really an area where prevention is really, truly better than cure. Because America, now in the 80s, when the vaccine was really introduced, it became a public something new. The sequelae, the consequences of chronic hepatitis B got so much reduced, okay? And for us here in Nigeria, we need to make sure that people are aware that those who are negative, for the virus should be immunized without waste of time. That will help to limit the scourge very much. So that will be major preventive. Of course, when people are aware of it, they now know how the thing is how it's transmitted. Adults will still avoid sharing of contaminated needles. Things should be sterilized. Blood should be screened before transfusion. And we are happy that in many centers, especially Lagos State here, you go to the antenatal where maybe spouses have to donate blood, they are screened for hepatitis. In fact, many of our patients are coming because they were screened and were found to be positive. And of course, that blood will not be used. Okay, so that's another preventive measure. And people should avoid unprotected sex, just like we have in HIV, because the mode of transmission as adults is exactly the same as HIV. The only difference is that transmission of hepatitis B is much more efficient than transmission of HIV.
The fact that viral hepatitis causes no symptoms until irreversible damage has been done to the liver makes it imperative for everyone to know about this silent infection and take precautionary measures to prevent and treat where necessary. Thank you for being a part of the show. You can catch up with these and some other editions of Health News on our website, channelstv.com, and on youtube.com/channelsweb. Let's also connect on Twitter. I am Yomi Otaigwe.